Cervical cancer, symptoms and causes. Cervical cancer is a type of cancer that occurs in the cells of the cervix, the lower part of the uterus that connects to the vagina. Various strains of the human papillomavirus, HPV, a sexually transmitted infection, play a role in causing most cervical cancer. When exposed to HPV, the body's immune system typically prevents the virus from doing harm. In a small percentage of people, however, the virus survives for years, contributing to the process that causes some cervical cells to become cancer cells. You can reduce your risk of developing cervical cancer by having screening tests and receiving a vaccine that protects against HPV infection. Symptoms: early-stage cervical cancer generally produces no signs or symptoms. Signs and symptoms of more advanced cervical cancer include vaginal bleeding after intercourse, between periods or after menopause, watery, bloody vaginal discharge that may be heavy and have a foul odor, pelvic pain or pain during intercourse. When to see a doctor. Make an appointment with your doctor if you have any signs or symptoms that concern you. Causes: cervical cancer begins when healthy cells in the cervix develop changes, mutations, in their DNA. A cell's DNA contains the instructions that tell a cell what to do. Healthy cells grow and multiply at a set rate, eventually dying at a set time. The mutations tell the cells to grow and multiply out of control, and they don't die. The accumulating abnormal cells form a mass, tumor, whether you'll develop cervical cancer. Types of cervical cancer. The type of cervical cancer that you have helps determine your prognosis and treatment. The main types of cervical cancer are squamous cell carcinoma. This type of cervical cancer begins in the thin, flat cells, squamous cells, lining the outer part of the cervix, which projects into the vagina. Most cervical cancers are squamous cell carcinomas. Adenocarcinoma. This type of cervical cancer begins in the column-shaped glandular cells that line the cervical canal. Sometimes, both types of cells are involved in cervical cancer. Very rarely, cancer occurs in other cells in the cervix. Risk factors. Risk factors for cervical cancer include many sexual partners. The greater your number of sexual partners, and the greater your partner's number of sexual partners, the greater your chance of acquiring HPV. Early sexual activity. Having sex at an early age increases your risk of HPV. Other sexually transmitted infections, STIs. Having other STIs, such as chlamydia, gonorrhea, syphilis and HIV/AIDS, increases your risk of HPV. A weakened immune system. You may be more likely to develop cervical cancer if your immune system is weakened by another health condition and you have HPV. Smoking. Smoking is associated with squamous cell cervical cancer. Exposure to miscarriage prevention drug. If your mother took a drug called diethylstilbestrol, DS, while pregnant in the 1950s, you may have an increased risk of a certain type of cervical cancer called clear cell adenocarcinoma. Prevention. To reduce your risk of cervical cancer, ask your doctor about the HPV vaccine. Receiving a vaccination to prevent HPV infection may reduce your risk of cervical cancer and other HPV-related cancers. Ask your doctor whether an HPV vaccine is appropriate for you. Have routine Pap tests. Pap tests can detect precancerous conditions of the cervix, so they can be monitored or treated in order to prevent cervical cancer. Most medical organizations suggest beginning routine Pap tests at age 21 and repeating them every few years. Practice safe sex. Reduce your risk of cervical cancer by taking measures to prevent sexually transmitted infections, such as using a condom every time you have sex and limiting the number of sexual partners you have. Don't smoke. If you don't smoke, don't start. If you do smoke, talk to your doctor about strategies to help you quit. Please subscribe to my channel, Alexa McCulloch Video, and click that notification bell for more updates.